am once more here trying to do housework and talk at the same time, and this is my fourth take, I think, and I have melted down every time. So, trying again. I never seem to get through this pile of clean clothes, and I am starting to suspect that the reason for that is that I am a human being. So I wear clothes, and then I wash clothes, and then I take the clean clothes and I just pile it on here, and I never get to fold it and put it away fast enough before I pile on with new clean clothes. And that is what I'm going to talk about today, because I have seen on Twitter that there is this debate or discussion about CBT versus psychodynamics. Yeah, you get me. And there is this one camp who, in the therapy profession, who say that intrusive thoughts, OCD thoughts, they are just that. They are intrusive. They don't have much meaning. They just will pop up. So don't think so much about it. Go home, live your life, and so on. And yeah, for some reason the patients aren't cured. And then comes the more, what should I call you people? The long talkers, the people who want to do more thorough therapy, who want to talk about it, who want to find the meaning in it. And they are from a bit different schools, so yeah. And they say that intrusive thoughts are not intrusive. They are your thoughts, and you are just not able to accept that sometimes you do want to punch people in the face. So you have to, the cure will not be to just go home and say, oh, this is intrusive thoughts and have no meaning. The cure is to go home and say, this has meaning for me, and it's a part of me, and sometimes I do want to punch people in the face. But you all are wrong. And the reason why I know this is because I'm in that group of patients. I do have this intrusive / meaningful thoughts that you can categorize both as OCD, and you can categorize it in my OSDD, my dissociative disorder. And I have been through these last, how old am I now? Yeah, the last 15 years, maybe 20 years. I have been through so many attempts at getting help to this. And nobody has been able to help me for some reason. And they all will say that that's my fault, of course, because they are therapists. So they are so great at what they do, but you all stink. I'm sorry to say it, you all stink. This is why this is the fourth take. I'm so angry. I'm so angry. Ah. Okay. Just try to get back to the video. Because I have been, first of all, I have been given diagnoses during my life that had zero usefulness to me, because if you just tell a patient that it's general anxiety, that is like saying go to the Library of Alexandria and start reading at A because you're a human being. Where's the usefulness in that? You have to actually give the patient a diagnosis that can help them. And then you have to kind of pinpoint where in the library or where on Google and so on they are going to start to find the information they need. But then you have these therapists who say that, oh, no, the therapist is supposed to be in full control over the treatment of the patient. And my previous therapists that didn't give me diagnosis, that just gave me this wishy-washy anxiety, depression diagnosis, they probably was thinking that, oh no, it's too much for little Suzanne to have to think about this herself. She's so stupid. She's just working in a university. How can she use your brain? She use her brain. Oh, I'm so angry. I'm just melting down. So first of all, you have to actually give people useful diagnosis. You have to give them useful words and concepts and labels so that they, in their situation, actually can do something to help themselves. And you have to quit this, oh, I have to be in full control of what the patient do, because you are just in their life once a week, twice a week, maybe once a month. So no, you can't have that control. I'm so sorry, but you just can't. If you want to have control, become a president, for fuck's sake. I'm so angry. Okay, trying again. First of all, it has to be useful, so you actually have to use labels. You can sit there and have this wonderful heart and be so rainbows and puppies you just want to, but we have something called the library system, and if you want to actually get patients to help themselves, you need to give them the correct words so that they can know where to look for information. Second of all, you shall not sit there and pretend that the patient is just this private person and that everything the patient's brain is thinking is in their private life and it's from their childhood and their stupid parents. No, it's not. I'm so fucking angry. Because I, with my OCD, intrusive thoughts, dissociation disorder, and so on, in all these years where I have had harm OCD, very severe harm OCD, in all my adult years of that, I have actually also been studying and working with the most severe violence and abuse you can think of in humanity. I am an expert on prisons, torture, war, human sacrifice, animal sacrifice, you name it. If it can be done, I'm an expert on it in my job. So that means that I have spent and are still spending hours upon hours upon hours every day, at least Monday to Friday. But I'm a workaholic, so also Saturday and Sunday, I have to admit that. So I spend all this time thinking about abuse and violence, all the time. It's my job. So when I have come to therapy and been told that, no, this is just intrusive thoughts and it has no meaning. No, that makes no sense. Of course it has meaning. It's my job. And when I have talked to the people in the camp who says, oh, it's because you have better morals than others. That's the reason. You are so stressed with this OCD thing because you have better morals than others. No. I don't. I don't in any way have better morals than others. Maybe a bit worse, actually. But it's my job. And then there is this camp who says that, oh, this is meaning and you have to talk about it. And it's because you are in denial of your own aggressive side. And it's like, again, no, I am working in the field I am an expert. I sit every single day with my brain. I'm using the same brain at work and at home, and I'm sitting every day and thinking about abuse and violence and torture and war and genocide and you name it. It's my job. So when you therapists try to cure people as if they didn't have jobs, as if they didn't have anything to use the brain for, it's like I'm melting down again. I'm so angry with you people. You are treating people like if they were just sitting at home and doing nothing. This is what Jung criticized Freud for, people. That he had just made it into a rich girl hobby. You have to accept that people have jobs. All these therapists and psychiatric nurses and psychiatrists who have tried to help me, they have not at any single moment in time accepted that I am an expert in what I am an expert on in my job. And that is why they have always missed with the treatment. They can never cure me because they do not accept reality. You people, you therapists, you are the problem. You do not accept reality. You do not accept the patient. That's the problem. You are trying to solve it in either one camp, in the theoretical thinking, where it's only intrusive thoughts, or you're trying to solve it in the other theoretical camp, where it's meaningful thoughts and the patient is denying their aggressive side and they are just try to smile all the time and deny that they want to punch people in the face. And it's like, in the middle here, people, in real life, you have people who work in the police. You have people who work in the military. You have people who work in the CPS. You have people like me who are experts, academic experts, working with this topic of violence and abuse all the time. And you are forgetting these people. You are sitting there and thinking that people like me don't exist. So that there is no reason for Susanne Nettobo to have these horrible thoughts in her head. Why should she? Because Suzanne is only sitting at home and looking at the birds anyway. She's just sitting on her porch and looking at the stars. And I have never heard about anything called violence research. Why should Suzanne do that? I'm so angry. No, I have to, I don't know if I can take more takes now. This is the fourth take. I think it was the fourth take. So this is the reason why I'm not working, people, because you therapists and psychiatrists and psychiatric nurses, you have traumatized me in my attempt to get help. You have traumatized me so that even talking about this makes me so overwhelmed with fear and sadness and grief and anger that I can't even take a 14-minute video without melting down. This is your fault. Okay, that just means that it's more work for you and I can just sit here and relax. So, okay. Now I'm so angry now. Okay, talk to you later, and if you tolerated watching me melting down in this video, maybe you can learn something from it. It's not intrusive thoughts. It's not meaningful thoughts. It's my job.